Hello, my name is Mira Patel, and this summer I participated in the Medical Student Summer Research Program, particularly in the Department of Radiation Oncology under the mentorship of Dr. Hina Saeed. Funding for this project was provided by the Wisconsin Medical Society Foundation Summer Fellowship Fund. For our project, we sought to analyze the interplay of socioeconomic status on female cancer outcomes for the minority population in Milwaukee County. Studies have shown that despite advancements to cancer care, being a minority predisposes an individual to an increased risk of specific cancers due to multiple reasons such as social determinants of health, educational background, financial status, and support system. With this study, we wanted to further assess the effects of socioeconomic status on cancer survival outcomes for disadvantaged populations. Therefore, we wanted to observe if female patients who are racially or ethnically disadvantaged and have a high socioeconomic status have similar survival outcomes compared to those female patients who are racially or ethnically disadvantaged and have a low socioeconomic status. We obtained data for our cohort from the Clinical Research Data Warehouse, specifically TriNetX and Honest Broker. Our cohort consisted of 310 female patients who are either white, African American, American Indian, Pacific Islander, or Hispanic, and who have either breast, vulvar, vaginal, cervical, endometrial, uterine, sarcoma of the uterus, ovarian, or fallopian tube cancer. To obtain socioeconomic status for each patient, we referenced the Milwaukee Health Report Socio-Needs Index and Socioeconomic Status Model. 34 zip codes were considered for the Milwaukee County, and we linked each patient's zip code to an index score of 1 to 5, with 1 indicating low socioeconomic need and good health outcomes, and 5 indicating high socioeconomic need and poor health outcomes. We also linked them to either one of the following socioeconomic status categories: high, medium, medium low, and low. Once the patients were linked, statistical analysis, specifically descriptive and comparative survival analysis, were reported with appropriate p-values, alongside tests of association, Kaplan-Meier curves, and a log-rank test to provide us with results. Preliminary results showed that socioeconomic status and the socio-need index had significant associations with race. From our cohort of 310 patients, only 60 had passed away, and our data demonstrated that minority patients from a medium-low socioeconomic status had improved survival outcomes in comparison to minority patients from a high socioeconomic status. Overall, our data showed that minority cancer patients had worse survival outcomes in comparison to white cancer patients, and the medium socioeconomic status group of cancer patients had better survival rates in comparison to all other socioeconomic status groups. Our final minority cohort consisted of African American, Pacific Islander, and Hispanic patients, and all the female cancers were included except fallopian tube cancer. Demographically, the minority cohort was considered low to medium-low socioeconomic status and signified poor health outcomes based on most patients having the socio-needs index score of 4. Our results reiterated the need for greater health equality as we observed differences in survival amongst minority and white populations. The most prominent limiting factor for our results was data constraints, as our cohort size was narrowed to patients who had survival data available for analysis. Specifically, this was the date of diagnosis, date of last contact, and date of death. This caused the medium socioeconomic status group to be the most reported group, which in turn could have impacted the survival rates for the medium socioeconomic status minority group in showing better survival outcomes in comparison to the high socioeconomic status minority group. It is our goal that an improved analysis of this data will be further used to assess survival outcomes for female cancer patients and to assess how more resources can be provided to cancer patients, particularly those that come from a minority population, to better their health outcomes. In the future, we will be updating the database of our cohort to make it more complete by including the patients who were initially missing survival data. We will also seek to analyze geospatial implications of socioeconomic status and cancer survival rates by using tools provided by the U.S. Census Bureau. Once again, I would like to thank the Radiation Oncology Department and the Wisconsin Medical Society Foundation for allowing me this opportunity and the funding to partake in this research project.